class. My name is Dr. Deb Silverman, and I'll be your instructor today for Nursing 101, which includes clinical. I know as students in hospital situations, you've not been allowed to go into rooms that require the use of a 195 mask or an N95 mask such as TB patients. We hadn't really allowed that to expose students to those kinds of situations. But now with the COVID virus, we are seeing more nursing students who still are in clinical starting to go into those rooms. So I do want to let you know how to effectively use an N95. An N95 is this mask here, and it filters out 95% of microns. So this is why we use it, because the droplets in COVID are very small. It's going to be hard to demonstrate just myself, so I have a statue here, a bust of John Kennedy, and so that will be helpful in demonstrating, so I can still explain. This is the box that the N95s come in. It's usually high up on a shelf in the back room, but right now in all hospitals they're under lock and key, and they will be passed out to you as needed. You will keep them when you're done in a paper bag with your name on it. So a lot of nurses are using the N95 with a surgical mask over it, and then the clear mask with the goggles on top of that, so that they can continue to use this, and some nurses are using these for up to a week. This is the box. If you want to see it or read anything on it, you can pass that around, and you can take a look at that. So the N95 has two straps, one on the top, one on the bottom, and a metal nose piece. So these are all very important. When you start in a hospital, you're tested to see which size you are. There's usually only two sizes that hospitals buy, small and regular. If you have a beard, you'll need to shave it. What is being used in a hospital right now are these great big huge masks. If you have a beard and they're hooked up to a motor, you won't be able to use those because there's usually 3 or 4 in an entire hospital. They won't be giving those to students. So if you have a mustache and a beard and you're in a clinical situation where you have to go near COVID patients, I strongly suggest you shave. So this is the mask here, and I'm going to show you, I'm going to demonstrate how to put it on. So if you've been identified as someone who uses a small mask, this is how you will put it on. The statue over here just to help demonstrate. So you will take this mask, hold it down so the straps are underneath, and you will put it in your hand. So once you have it in your hand, like this, you can all see that, you will place it on your face. You will place it on your nose and under your chin. So it's over your nose and under your chin. You will then take the bottom strap right here, and you will place it over the back of your head, like that. And you will take, that usually goes under the ears, yeah. And you will take the top strap and go over the top of your head where it will comfortably stay, so that it's in the back of your head like that. Then you will pinch the nose piece so that it's tight around your nose, and you will take some deep breaths in. And what you'll do is you'll put your own hands over the mask, you'll take deep breaths and blow out. You shouldn't really feel the air coming around here, the air should be going out. So you won't feel the air coming out. So that basically is how you put them on. To take them off, you would basically just reverse the process. So you would put your hand over the mask, take off the straps, and if you were going to throw it away, you would just crumple it in your hand and throw it away. So this is my personal mask from work, and I haven't been in any COVID rooms yet, but this will be my mask for the next week. So I just want you to know that we're being especially careful with these, and we're saving them. Does anybody have any questions? Okay, so to recap, these masks are for use only in COVID rooms when you have a patient who's coughing, and otherwise you're to use just plain surgical masks. Thank you.